Hello, I'm Dr. Jon Steinberg. I'm a consultant psychiatrist and I'm the medical director of the Caloundra Private Clinic, and I'm a consultant psychiatrist at the New Farm Clinic, which are both Ramsay healthcare facilities. Today I am here to talk about old age psychiatry. When you first see an old age psychiatrist for dementia, you might have been referred by your GP for an assessment. So the psychiatrist will have to ask you a lot of questions. Usually the psychiatrist will see you on your own because they want to assess you on your own and see how you're functioning. The psychiatrist will ask you lots of questions about recent problems, how they developed, what you've noticed about your memory, for instance, if you're worried you've got dementia, ask you questions about mood, anxiety, depression, take your alcohol history, drug history, see whether you've used alcohol excessively in the past, and talk to you also about your personal history as well. What age of schooling you went to, for instance, or how you've achieved academically, or what your work function's been like through your life. So psychiatrists will try and get to know your entire history of your life story, but also how you're functioning recently and what the symptoms are that you're concerned about. So you might be asked to do little tasks in the office. These tests sometimes take 5 or 10 minutes, but the psychiatrist can tell an enormous amount from short-term memory tests, for instance, and language tests and orientation. Another important thing the psychiatrist will do is if you've got a relative or spouse or friend or carer who's come with you, we will interview that person to make sure that we get their side of the story, to hear what their concerns about are, and if they've noticed any changes over time. It takes a long time when you see a psychiatrist sometimes. Sometimes it might take an hour and a half, and you need to be seen over a number of interviews sometimes to come to a conclusion. When you're seeing a psychiatrist as an older person, we order tests. So we often, particularly if we're concerned about dementia in old age, we do want to do tests on your brain, so an MRI scan of your brain, for instance. So we will send you to an X-ray place to have that test done, and sometimes you come back with that test at your next appointment. We also order blood tests as well. Come back to the next interview, usually within a week or two, and we can then discuss all the findings and make a diagnosis at the time, and then plan treatment from that. It is important in older age that you have a mental health problem diagnosed as soon as possible, whether it's a mood problem like depressive illness, whether it's an anxiety condition, whether you're actually developing dementia. It's very important that you get a diagnosis as soon as possible so that treatment can be planned and your family can be involved in that, and there might be changes and tests that need to be done. Things need to be organised as soon as possible. And so it is very important that your condition is diagnosed. Psychiatric illness can lead to disability, and we know that your physical health might deteriorate as well in old age, and we know psychiatric illness and physical illness together can lead to a much worse quality of life and a much worse outcome for your physical illness as well. So we need to get that psychiatric diagnosis and start the treatment as soon as possible to prevent a deterioration not only in your mental health but also in your physical health. We also know that carers can be very stressed by looking after someone with mental illness, particularly with dementia in old age. And we know that the person with dementia, their outcome and their health can be made much better and the quality of life's much better if their carer is involved in their support and involved in helping their illness, and if their carer's not stressed. We don't want the carers to be stressed, so it's important to diagnose the condition as soon as possible and treat it to reduce carer stress and carer burden in the long run. In older age, there are a number of mental illnesses or psychiatric conditions which can be treated. Now, the treatment is very effective and can be given both in forms of medication to treat illnesses such as depression or anxiety. Those medications are effective, generally safe. Some have side effects, but the doctor manages those. The medications have to be taken over a longer period of time to treat the illness. In the short term to treat the illness of depression and anxiety, and then in the longer term to prevent the recurrence of depression or anxiety. So it's very important that treatment started early and it's effective and the side effects are minimised, so that somebody with depression, anxiety in old age can take it in the longer term. Sometimes we have to admit people to hospital with depression or anxiety because maybe their illness is so severe that they're not looking after themselves at home. Perhaps they've got suicidal thoughts that need help in hospital. And some of the treatments we have to give in hospital. So some medications in old age, because people might have lots of physical illness, we need to watch very closely for side effects. Now, when we treat people in hospital for those conditions, there's medication, there's good nursing care, diet, exercise in hospital, all very important. If people don't respond to medications with their severe depression, sometimes we choose to use, as doctors, we choose to use electroconvulsive therapy or ECT for those patients, which is given intermittently throughout a week to improve the outcome in depression. Because sometimes people don't respond to medications, but particularly with older patients, if medications haven't worked, ECT can be very effective. So almost 95% success rate of treating severe depression in older age. So ECT is very effective in that group of patients. So it's very important to involve medication treatments, physical treatments, but also psychological therapy. Now, as psychiatrists, we do individual psychological therapy with our patients, whether that's cognitive behaviour therapy or anxiety management techniques or insight therapy to help people understand their conditions. But also sometimes it's particularly in hospitals, we conduct group psychological therapy programs, and they can be very effective so that people in older age can learn about how other people cope with depression and anxiety, for instance.